Hi there, this is Mark Ittleman, speech-language pathologist, and this video is going to be entitled, Singing is Not Talking. You know, it's a big thing on the internet today, and we're seeing speech pathologists with their guitars, and we're seeing patients who are singing various songs that may have been sung for 10, 20, 30, 40, 50, even 60 years with some of these patients. And a lot of these songs are just rote. And we all have these rote songs in our minds. Just think of Row, Row, Row Your Boat, or Happy Birthday, or My Country 'Tis of Thee, or the Star Spangled Banner, or gosh, there are just hundreds of them. And these are songs that we've sung over and over and over again since we were children. And one of the interesting things about those with aphasia is that they can often basically sing these songs. And whenever somebody observes a person with aphasia singing a song, they think, wow, this is great. Their speech is coming back. But it's not speech. It's just not, because singing is not speech. Speech or conversation involves two processes. It involves comprehension first, because when we talk with each other, if we break it down to the most simplest of elements, when we talk to each other, one person says something to another. And then the other person comprehends what was said, thinks about it for a minute, and then responds. They either answer the statement or they comment on the statement. Now, you have to remember, too, that speech or communication is made up of two processes equally. And those two processes are the ability to ask a question and the ability to answer a question. Singing has nothing to do with that process. Singing is just regurgitating something that you sang over and over and over and over again through the years. So, if we're going to spend any time with patients as speech-language pathologists or as caregivers, we must duplicate in context a conversation that includes the ability, first of all, to comprehend. The individual with aphasia must be able to comprehend simple questions. Now, the other day I viewed a video and they had somebody there, and the person who was singing didn't look like he really comprehended the question that the therapist asked him. He kind of looked a little dumbfounded. And that's what happens with a lot of people with severe to profound aphasia. They have difficulty comprehending, especially comprehending speech that's presented to them in a rapid, normal speed. That's why we believe, with the teaching of talking, that when you talk with someone or converse with someone and you're working on their speech and language, you're working on not only their expression, you're working on their reception as well as their expression. Now, if they're only speaking in an occasional one or two words, you can't have a conversation with them using normal speed and normal sentence length or question length, okay? Because what I've found through the years working with people who have aphasia is that you have to use the number of words when you converse with them that they produce expressively. So if a person is occasionally speaking in one or two words, that's where we start in a conversation. But you've got to start working with people and having them decode language again, having them comprehend the question, having them comprehend the statement. But there are a lot of exercises that therapists are doing out there that are just working on comprehension, and they're having them do things and put this there and put this there. No. The process, if you're going to get a person to talk, must involve talking. And you can use simple comprehension when you're talking. That's the time when you work on receptive language as you talk, as you converse, as you speak to a person with severe aphasia in one or two words. So just remember now that singing is just not talking. And you know, it's so hyped. It's so hyped. And a lot of speech therapists are falling for that idea. And a lot of caregivers are falling for that idea. And they want to find therapists who are going to sing and all of this. Now, I'm not saying that singing a song during a therapy visit isn't a bad idea. In fact, it might be a good idea. But the focus of therapy is on talking. And talking is not singing. Talking is, first of all, comprehending what's being said. Then the individual with aphasia must comment on that or answer the question. And then that goes back and forth, and back and forth, because that's what talking is. When we meet with our friends, we talk back and forth. And that's what we should be doing in therapy. We shouldn't be singing. Singing is okay if they want to become a rock star or an opera singer, but that's not really the area that a speech pathologist should really be working on. And I know I'm going to raise a lot of tail feathers here, but it's true. I've worked with patients over 40 years, working with them with singing and exploring that. But you know something? When you work with a person with singing, they have a good time, you have a good time. They sing 3, 4, 5 different songs, and it's great, and everybody's happy. But the first minute you stop singing and you go back to a conversation, then the same thing happens. They're dumbfounded because you haven't worked on their comprehension, their decoding of language, nor their expression of language. So I wouldn't spend a whole lot of time or effort on singing because it's just rote and it doesn't involve the comprehension nor the ability of the patient to think about words, to think about an answer, to think about a sequence of answering a question, the syntax, the grammar, the phonology, the sounds. These are the things that we've been trained to do, not to sit around a therapy room and sing songs. So this is Mark Ittleman, and I hope I haven't bothered many of you, but I'm trying to explain something that I believe thoroughly that therapists need to know, and the sooner they know it, the better, because you won't be wasting time on activities that are not related and not similar in process to the ability to receive language, comprehend language, and express language. This is Mark Ittleman from the Teaching of Talking. If you have any questions or comments, please put them down below, or send me an email at markittleman@teachingoftalking.com. And if you want some information about the process of stimulating speech and language that I've been speaking about, that's a part of our work with the teachingoftalking.com. So thanks a lot, everybody, and have a great day today. Bye-bye now.